Hello, everyone. My name is Vikeen Patel. I'm a medical informatician here at Banner, but I am a practicing hospitalist at multiple sites and a proponent for using Regard on a regular basis. I've been using Regard since 2022 in our pilot, and I would like to share some best practices for utilizing Regard to the fullest. Starting off with first utilizing the M-page view under the Regard workflow. Now, this could be found when you open up a new patient's chart and you select Provider View from the blue menu bar here. Once you select Provider View, you should default to the M-page selection called Inpatient Workflow, and you'll need to add the Regard workflow if you don't already by clicking the plus here and finding Regard alphabetically at the bottom. I've already added it, so I'll go ahead and scroll through this. Now, this is a copy of your inpatient workflow. As you can see, it has the same links, except for one additional one, which is this quick links view, which has the regard tool. And the regard tool is available also in the blue menu, but we won't be utilizing it today. So once you've seen your patient, have interacted, and you've completed your subjective, objective, and review of systems, if needed, you'll go ahead and click the regard link here. Now, regard is extracting information from the chart and we'll then pull that information in, and it takes a little bit of a time to digest it. Once it's there, some quick notes is you'll see the time that it was there, when was it last saved, and if there's more information that comes in, new lab values, etc., you can click the refresh right here, and that'll take you back to that main page where it's now importing the fetching the data and doing its algorithmic look back. Now, Regard looks at documentation, it looks at lab values, is looking at medication, is looking at image results, just the reading radiology results, in order to analyze and find nuggets of conditions that might be applicable to a patient. So this is augmenting what you already know and already doing, but maybe helping ease some of that cognitive burden that you might be feeling, like how do I remember 14 new conditions? It also does a organization of more common conditions at the top with information and then going down. Now, as you can see, it opens it up. If there are previous notes, it's going to import that information. So we call that the copy forward part. However, in this case, in this example, I'm going to choose the base note, which you can change by clicking the change base note here. Now, Regard has found 14 new diagnoses, but not necessarily that all are applicable for this patient. That is where we have some time to really hone in on what is applicable for this patient versus not. So if we look at our first condition, which is CHF, I can see that there's some medications that they already brought in. Now, if I agree with it, I want to go ahead and click the little plus here. Now, the reason for that is sometimes this information is not always applicable, and we don't want you to be not using your clinical acumen in order to justify it. But let's say I also want to say that we're monitoring I's and O's and weights daily. You can hit enter and then put in a dash or whatever you like to do, and go ahead and interact into the note right in here. You can use your dragon and dictate within there. So we'll go ahead and say monitor I's and O's closely, weights daily. And you can also add this within here, any medications or monitoring electrolytes, and continue on telemetry. And this will go ahead and copy forward. Now you can see that this condition has already been accepted. If there is, for example, a condition that maybe isn't applicable, for example, this thrombocytopenia chronic, just because we discontinue apixaban doesn't mean that if we click on this little green icon here or highlight within here, thrombocytopenia, you'll also see where this information came from. How did they come up with this diagnosis? Now, in this case, there's not a lot of information here, and I don't really necessarily agree with it. So I'm going to go ahead and hit this dismiss icon. What that does is it removes it from the list and it won't be copied forward. You can add it back by hitting restore. It's at the bottom. Another example that I like to use is conditions that might be resolved. Now, in this case, the patient had GERD, but no longer has having it. So we'll go ahead and shelve this diagnosis, meaning putting in the chronic section. This means that from a future perspective, this was something that you did interact with this admission, but didn't continue to use. So you can go ahead and shelve that. Now, not all conditions have information, and that's okay because we're looking at information from the chart, and you can, of course, click on any of these links to find that applicable information. So for example, if I look at diabetes, you'll see that it's tracking hemoglobin A1C levels, where it is in the problem list. And then if there's any other conditions applicable, you can also click on help and resources here in order to find out other information about this condition. And if there's anything that you find that's wrong, you can provide feedback right here. This way to make the algorithm much, much more happy. So we'll go ahead and hit plus plus on this. We see that we have chronic atrial fibrillation, and we calculate automatically the CHADS VAS score and risk for stroke. Go ahead, plus on that. And unfortunately, we discontinued apixaban. We probably shouldn't do that, but go ahead and continue that, continue that. Obesity is a big one. It's looking at the last time this was calculated and a complication rate along with it. COPD, and I don't agree with pulmonary hypertension in this case, so go ahead and dismiss that. And CKD stage 3. If I click on it, it looks like this was just a problem added by Dr. Oros. I don't have any lab values to correlate with it, so we'll go ahead and dismiss that for now. And if I wanted to add anything here, if I wanted to add a new diagnosis, like for example, some social interaction issues, you can just click add diagnosis here and say housing instability, and go with that one. And that'll automatically drop another problem, which will then carry forward. Noted on our form social work consulted for. And finally, now that we have all of this done, and I'm happy with what the note has come out to, I'm going to go ahead and click copy note. And as a quick aside, all you have to do to go back to your other workflow page is hit this back button here and go ahead and start a progress note. You can, of course, copy and paste this right into here by hitting Control V. You can see it added all of this right into here. And I'm going to click my progress note, which will open up DynDoc and put in that information here. I can add my medical decision making to help justify some of my coding today. And then, of course, all of this is editable here and will copy forward. So if I wanted to remove, say, that I discontinued furosemide here, or I discontinued all these medications, I can just do that here and edit it, and this will appear in the next day's note when you do open regard. Once I hit that, I'm going to hit sign and submit. And as you can see, it's built a assessment and plan that really helps with justifying billing coding, as well as a good continuous look back as to what we're doing for this patient, what we're doing, and how we're monitoring. Now, if I come back the next day and I go ahead and click regard again, and it will change the base note back to the newest note that I just did. Of course, I have to refresh it so that it recognizes that new note has been completed. And normally we'll do this every time when you're loading the patient. So if it is the next calendar day, you'll notice that there. It also allows you to customize any of the fonts, bullet points, etc., right within the tool, which is kind of nice. If you're like myself and you want to bold something like monitoring weights daily, you can go ahead and do that right here. Bold. And see here, if you click use this as a base note, a load note, it'll go ahead and do that there. You can also fast track through here by going through. It'll label and rearrange anything you need by clicking the move button. And you can see you can drop it in after any of these places by putting it there. And it'll also renumber it for you as well. So utilizing this on a day-to-day basis is nice. You can also continue to expand upon what's available, and the tool itself is very adaptable and is being constantly updated with the feedback that we provide them as well as others that utilize the tool. And so if you notice things that maybe need improvement or need to have different calculations, just go ahead and hit the feedback button here. And so they'll be able to work on that. So why do I use regard? I know you've probably seen these bullet points in the past, but really for me is I want to offload some of that cognitive burden. There are a lot of conditions that are applicable to the patient but may not be paramount to the care that they're receiving, but it's stuff that we're already doing. I'm already continuing some of the medications for hyperlipidemia. I'm not going to research it. I'm not going to look it up, but I want to make sure I capture that information because it is showing the complexity of care. It's helping me raise my CMI and capturing some MCCs that's required for, appropriate allocation of days. If I got a patient who came in with pneumonia and I look at their medications and I notice that they're a little hypotensive, is it really related to pneumonia or is it because, they're on too much medication? It's going to help me with that too. And one of the biggest things I do not like is receiving CDI queries for things that aren't going to make a big difference, like obesity or some of the simple stuff like hyponatremia. Like I know they have hyponatremia and I might have forgotten to put it in. But regard really helps me by addressing those and capturing them so that I went, oh, yes, let me include it. And then let me also talk about that. Thank you all for watching this video. It's important that we utilize the tools to the fullest extent. And thank you for spending the time listening to me jar on about how I use regard.